Hi, my name is Ragni Sommerbakk, and I am the Norwegian PhD student in the Impact project.
Hi, my name is Jasper. I'm the Dutch PhD student in the Impact project. The Impact project is an EU-funded research collaborative that aims to implement quality indicators and identify optimal strategies to improve the organization of palliative care. In this video, we will give you a short update of the progress we have made so far.
And in the first year, we started out interviewing policymakers and healthcare professionals in order to map the palliative care services available to patients with cancer and patients with dementia in different countries in Europe. This data was then used to develop a model describing both the services, the healthcare professionals, and the legal rights that are available to these patients and their families. We are now in the process of getting feedback on this model from policymakers, and we will be updating and continuously this model throughout the 4 years of the project.
In the second year of the project, we started the actual preparation for the pre-test intervention post-test study that will run in year 3 of the project. Therefore, we conducted a literature review that identified strategies to improve the organization of palliative care. We also conducted interviews and focus group interviews in England, Germany, Italy, Norway and the Netherlands with professionals working in palliative care in order to identify barriers and facilitators of these improvement strategies. We did this so that we can tailor our own strategies that we will be using in our intervention study. Lastly, we conducted the Delphi procedure in order to compose a set of quality indicators. We, together with a total of 40 international experts, we selected a set of 23 indicators.
And the indicators that Jasper just mentioned have been operationalized in questionnaires that have recently been used to assess the organization in 40 healthcare services in Europe. And this data will help us pinpoint areas where there can be room for improvement regarding palliative care. And the results are now being fed back to the services, and they are being asked to each choose 3 objectives that they would like to improve. And then they will receive help from us to formulate an action plan with strategies which should help them improve their organization in these areas. Then, by the end of the year, this year, there will be a post-test which will indicate whether or not they have been successful in improving their organization in these chosen areas.
We know that there are quite a few factors that can either hinder or stimulate improvement projects. In order to identify such factors, we will be doing a process evaluation. We've collected data for this evaluation throughout the entire project. First, we have collected data describing the services and the participants that are participating in the study. Second, during the intervention study, we will be following the services closely in order to document the improvement strategies they are using, challenges they are experiencing, and how they solved these challenges. And lastly, after the post-test has been completed, we'll be doing individual interviews and focus group interviews with professionals in order to shed further light on the factors that influence the implementation of the intervention.
And the aim of all of this is, in the end, that other services can use this information in order to tailor their own improvement projects in palliative care. Therefore, we will develop a toolkit which will hopefully help these services avoid the major pitfalls and give them an easier time to facilitate a successful result.
We hope that you found this video useful. If you would like to receive further information, please visit our website or watch our future videos.
Thank you for watching.